Hey everybody, my name's Taylor Morgan, and I'm the English 114 class. My research topic I've chosen to do is diagnostic imaging. What is diagnostic imaging? Well, today we're going to cover possible job opportunities, job descriptions, the salaries, the job outlook, and the education requirements for any of these career paths in diagnostic imaging. So diagnostic imaging is X-rays, CT scans, MRIs, anything that could help the doctor diagnose what's going on with your patient. Diagnostic imaging is a non-invasive career, so you do not have to introduce any instruments or needles into the patient at all. The main goal of diagnostic imaging is to identify and monitor diseases and injuries by taking images of the anatomy and organs in the body. So there are many careers such as radiology tech, assistants, mammographers, CT techs, MRI techs, but today we're just going to cover radiology tech, mammography, and radiology assistant. So first we'll start off with radiology technologists. Their main job is to provide quality patient care and image possible diseases and injuries that the patient may have. The education that is required is you must achieve a associate's degree in radiography and get your gen ed classes completed. You must be approved by the Joint Commission of Education of Radiology Technologists to be a licensed tech. This is important because this has to be renewed every 10 years. Jobs that you can possibly have as a radiology technologist are you can work in a private practice, a hospital, an urgent care, or a travel tech. The salary of a radiology technologist is the top 10% makes about $77,000 a year. The bottom 10% makes about $37,000 a year, and it's expected to increase 9% of job opportunities from 2018 to 2028. This is about what the radiology room does look like. So there, she's positioning a patient right there. So next we're going to go on to mammography. Mammography, the purpose of mammography is to provide an early detection of breast cancer, lumps, or tumors that the patient may possibly have that need to be detected. So the education you need for a mammography is you need to become a radiology technician. So that would be an associate's degree in radiology tech. And then you can have on-the-job training, or you can go to continuing education classes to specialize in this field. Some colleges offer certain paths that lead you straight into mammography, but most around here, you just have to get a degree in radiology tech. So the average salary in the top 10% is about $79,000 a year for a mammographer. The average is $72,000 a year. It's expected to increase 9% from 2014 to 2024. Here is the mammography. This machine is where the woman or man, if they're coming to get one, will put their chest or breast in this machine, and it will show an image like this. So next we're going to move on to radiology assistant. What is a radiology assistant? There's not many opportunities like this around anymore because most of all the radiology techs kind of all work together to work under the radiologist, as does a radiology assistant. A radiology assistant is an advanced patient care under the supervision of a radiologist. They help perform exams such as esophograms or GI studies or arthrograms where they look at the joint space in your shoulder or knee. So for this education, you will need a bachelor's degree in applied sciences or biology. You need to become a licensed radiographer. Just as a radiology tech, you need to work as a radiology tech for at least a year to gain your 1 year of clinical experience. And then you need to make sure that you are certified in every way so you can be in the running to become a radiology assistant. The salary for a radiology assistant, the bottom 10% is about $30,000 a year. The top 10% is around $130,000 a year and is expected to increase 9% from 2019 to 2025. And here's a radiology assistant. That's an arthrogram. They're looking at the joint space and things like that. And in conclusion, Hard work and dedication will help you reach your goals of becoming and having a career in diagnostic imaging. Quality patient care is always the most important thing when you're working in the healthcare field. And these jobs will feel rewarding knowing that you've helped somebody become diagnosed with something or relieve the stress of thinking they might be sick. So that's all I have.